And now it's time for The Doctor Is In.
I'm Meredith Armstrong, and this is The Doctor Is In. Today we have with us Dr. Dunya Muhammad from USA Health System Pediatrics, and she's here to talk to us about hypertension in children. So tell us exactly what is hypertension in a child?
Right, well, thank you for having me. So any elevated blood pressure in a child that meets certain criteria for their age, gender, and height will be defined as hypertension. Now, it's important for these blood pressure measurement to be taken accurately when child is still and calm and not nervous or stressed in the upper extremity, and it has to be documented on 3 occasions to meet the criteria for hypertension. Elevated blood pressure is an earlier stage of hypertension, so when the blood pressure is lower, it's called elevated, but once it meets that criteria, then it's defined as hypertension.
How often and when is it checked in children?
Routinely, pediatricians are recommended to check blood pressure starting age 3, and after that annually in every child visit. But for children with certain risk factors for blood pressure, it's recommended by the American Academy to be checked in every well-child visit, and thus include children who are overweight or obese, or children who are premature, or children who are on medication that could elevate blood pressure.
So talk to us about common causes, or some of those things you just mentioned, some of the causes that you see.
So the reason a nephrologist is talking about blood pressure is that because 2 in 3 of children who are diagnosed with high blood pressure have some underlying kidney disease. So kidney disease are the more common in children as a cause for hypertension compared to adult. And then also comes the heart disease that could cause hypertension. Now, there are certain genetic disease that can give children high blood pressure regardless of kidney involvement. But those are the main organ system, kidney, heart, and genetic disease that could cause hypertension in children.
Very interesting. Dr. Muhammad, we are going to dive deeper into this conversation, so join us online for social media and more with Dr. Muhammad about hypertension in children. I'm Meredith Armstrong, and we'll see you next week on The Doctor Is In.